I'm an occupational therapist. In occupational therapy, you can work in outpatient, you can work in the hospitals and inpatient, you can work in like psychiatric wards, you can work in behavioral clinics, you can work in people's homes with home health. I have a master's degree. My undergrad was in occupational science. And then I was doing like a dual program, so it's occupational science and occupational therapy together. So I was really understanding and learning about occupations as a whole. I work with kids with special needs and different abilities to be able to do all the things that they want and they need to be able to do within their daily routine. So I will go to multiple schools in a day. I might have 3 to 5 children that have OT. When I'm done with that, I'll do some documentation on all of those different students. Then I might have an evaluation or 2 that needs to be completed. What we do for evaluations is just to see if a kiddo qualifies for occupational therapy. I am looking at all of their different fine motor skills. I'm looking at their cognitive skills. With their fine motor, how are they using 2 hands at once? What are their grasp patterns like on different objects? And kind of fun because we get to look at the skills through the use of play. Occupational therapy is very individualized. We look at the person's individual goals, and then I design a treatment session around what the goals are. We can actually retrain the brain by doing different techniques, different activities with the kids. One little girl in particular, she asks all day, "Is OT on my schedule yet?" So they look forward to seeing me and I look forward to seeing them. It's fun, but everything you do, you have to document what you did and why. And so we're not just playing with the kids, we have play with a purpose for sure. It takes someone who is definitely patient, someone who's kind, someone who is flexible and willing to try new things. What works for one person does not always work for another person, so you have to be adaptable to be able to work with a variety of populations. It is wonderful to see a child progress through that developmental sequence, but also it's really, really hard when a child might get stuck and we're not really going anywhere. Sometimes that's hard for parents to accept. Therapy might need to be over. Sometimes that's a little bit hard, that they've reached their peak and their max of what they probably can do. We are working to improve people's skills overall. And when people are able to do the skills that they want and need to do every day, they are able to go and take those skills and perform them out in the community. So when everybody's doing the best that they can and they're feeling their best, then we all thrive as a community.